Hello everyone, this is Dr. Bhavika Sane, Progenesis Fertility Center, Vashi. Let's talk about the embryo freezing. What is embryo freezing? Embryo freezing is also known as embryo cryopreservation. It helps in preserving the embryos at an ultra low temperature using a vitrification. This process allows the indefinite storage of the embryos for a longer period of time and can be used when required when they are thawed and transferred into the uterus. This process allows the indefinite storage of the embryos, which can be thawed and used for the future IVF cycles. The main goal is to prevent the ice crystal formation during the freezing, as it can damage the cells. So the cryoprotectants are used to protect the embryos. How is the process of the IVF and how is the process of the embryo freezing? So first it involves a ovarian stimulation and the egg retrieval, then the fertilization. Embryo assessments are done. Embryo assessment are determined by its suitability for freezing. This process usually occurs at the blastocyst stage, which is a day 5 or a day 6 embryos. Vitrification, that is called as a freezing. The vitrification, this is the most common method used today. It involves a rapidly cooling of the embryos and then they are stored under a liquid nitrogen, which is at the ultra low temperature at minus 190 degrees Celsius. This prevents the ice crystal formation, and then the embryos are stored into the nitrogen tanks. This helps in the embryo transfer and thawing. The patients are, when they are ready to use those embryos, they are thawed to a neutral temperature and then transferred into the uterus. Now come points, who should consider the embryo freezing? The couple undergoing an IVF procedures and having more than the embryos needed for the same IVF cycle should consider for the embryo freezing, as that can help in the further pregnancies also. The cancer patients who are about to go for a radiotherapy or a chemotherapy can freeze their embryos. Also, the individuals who wants to delay their parenthood and want to achieve like their professional or a personal outcome, they can even freeze their embryos. And also for the pre-genetic testing, the people having some hereditary disorders. Let's talk about the benefits of the embryo freezing. It improves the endometrial preparation. FET allows the controlled timing of the implantation and potentially leading to a better endometrial lining and development, with also the higher implantation rates. It reduces the risk of ovarian stimulation, as the FET avoids the risk by allowing the delay between the stimulation cycles. And also in the genetic testing, as the pre-implantation genetic testing can be performed when the embryos can be freezed at the levels of the blastocyst. Now comes how long the embryos can be stored. Frozen embryos can be stored for an extended period, potentially indefinite time, because of the current technology. While the storage periods are often about 10 years or even longer, as long as they are properly maintained under the liquid nitrogens. Success rate of the frozen embryo transfer. Frozen embryo transfer success rate varies. Generally, it is comparable to the fresh embryo transfers. Factors affecting like the woman's age, the embryo quality, and then the clinic's experience significantly influences the success rate. So the embryo quality makes a major and crucial factor into it. I hope the queries about the embryo freezings are clear. If you have any queries regarding the fertility treatment, please comment below. We will surely address your concerns. Thank you.